All right, everyone. Thank you so much for joining today's presentation from the Transportation Equity Task Force of ABLE, New Hampshire. We're doing this every month, and we're so glad that so many of you are here. I do just want to share for housekeeping that the meeting is being recorded. Right now, the audience is muted, and you won't be able to turn on your camera. You can use the chat feature throughout the meeting, and you can raise your hand as well. This is just to prevent interruption because we have so many incredible speakers and presenters that are going to be here with us today. Advocates Building Lasting Equality in New Hampshire, ABLE New Hampshire, advocates for the civil and human rights of children and adults with disabilities. We promote full participation by improving systems, connecting families, inspiring communities, and influencing public policy. Every year, ABLE gets together and looks at their priorities, make sure that we're working on the topics that matter the most to the people that we're serving. And in 2024, we were told that transportation equity was one of the most important topics. So we initiated a task force for transportation equity. That task force has been working on several initiatives, but one of the primary is the Lunch and Learn series. Next month, we're going to hear Keep New Hampshire Moving. In December, we hope to be able to learn what's new with Uber. January 16th is Assistive Technology for Transportation. The reason that we do this is because we want to help people become aware of the many transportation options and resources that are out there and to make sure that you really feel comfortable using them so you can get to where you need to go. We do have an archive of one-pagers from our previous Lunch and Learns. So you can find those on the ABLE New Hampshire website on the Transportation Equity Task Force page. It should be pretty easy to navigate to from there. And for today, we're going to be talking about non-emergency medical transportation. In other words, getting to appointments with Medicaid. So I'm going to go ahead and turn it over to Catrina, and Catrina is going to kick us off.
So I just have a couple slides to introduce the non-emergency medical transportation benefit with New Hampshire Medicaid. So I have here, what is Medicaid non-emergency medical transportation? It is a program to ensure that transportation is not a barrier to a member receiving Medicaid services. Transportation allows you to go to any services that are covered by Medicaid. It is only when you have no other means of transportation to receive your Medicaid services, and it should not be used in a medical emergency. So if you do need emergency medical transportation, you should go ahead and dial 911 or go to your nearest emergency room. You don't need any kind of referral first for that kind of service. So what services are covered by the non-emergency medical transportation benefit? In general, it is only available for services that are authorized, by Medicaid covered services to a Medicaid covered provider, unless you have additional services authorized by your MCO. This includes medical, dental, and pharmacy benefit. And then the nuance there is that some individuals are covered under a waiver through Medicaid. And if you are covered by the waiver, if you're getting a activity through the waiver, you'd want to talk to your case manager or the Bureau of Developmental Services to discuss options for transportation to assist you for those services. And I have a slide here about the timeliness and availability of non-emergency medical benefit transportation. So for scheduled trips, we expect 98% are scheduled, and we're above that mark overall. And then the timeliness of the scheduled rides, we expect 95% are on time, and we are above that as well. Here you can see. And I'm going to turn it over. These are the representatives that for each MCO, and then also for DentaQuest. And I'm going to turn it over to Michael for AmeriHealth.
That work for everybody?
It's good, Mike.
All right, fantastic. So first I want to say thank you for the invitation, and the opportunity to present I think is important. I will be brief. I'm going to go over some highlighted information because the detailed information will come from our partner broker, who is Coordinated Transportation Solutions, also known as CTS. So I won't double dip on that information for everybody in the interest of your time. Did want to point out a couple of things regarding our member website. there are relevant links where anyone can go to get connected with your care manager and with the landing page for your non-emergency medical transportation benefit. And that's at the AmeriHealth Caritas NewHampshire.com/member website. Your care manager can offer assistance in multiple ways, not just with transportation, but specific to transportation, even calling the broker CTS directly on the behalf of a member if necessary. And then the transportation page will provide the relevant information up to and including reimbursement request forms for people who are going to use the family and friends benefit. I chose next to talk about what I call an important reminder, and it's in regards to some of the difficulties people have experienced with trips. I found a common thread in my experience here at AmeriHealth, and that is to share with everyone that if our partners at CTS are notified in real time, and by doing that, I mean specifically if they're made the first point of contact, put the number up on the screen, they have the tools, the resources, and the information right there. So if we can get connected with them in real time, if you're having an issue, there's a much higher likelihood that they can provide a resolution that prevents either a missed trip or a really long delay that is very, very frustrating, and we don't want anyone to experience. So that is that reminder comes out of my experience in finding out that there was an issue well past when the issue occurred, and then to find out that CTS was not notified first. There are other people that may need to be contacted. I'm not trying to prevent that. I'm trying to funnel it through as a first point, call them, and then I'll end that point by saying, if that doesn't provide the resolution that anyone is seeking, if you're not happy, if it didn't work, I am always available to be reached directly. I put my information up here on the screen for people to write it down. I want you to call if you're having an issue that doesn't get resolved. I just want you to give our partners who are very committed the first chance to do that. And then if I'm needed, I am always going to be available to any AmeriHealth members. Put up our general contact information again. And when CTS has their turn to present, they'll go over the specifics of how to access your benefit, how to set up appointments, and all of the other information that you'll need. And that is it from the AmeriHealth side. I'm going to turn it over to Tatiana.
Hi guys, my name is Tatiana. I'm the outreach coordinator for DentaQuest, and we'll be talking about the transportation services under New Hampshire Adult Smiles Medicaid dental program. So the dental program is administered by Northeast Adult Dental in partnership with DentaQuest, and we provide adults 21 and over who are eligible for the New Hampshire Smiles Adult Dental Program. And we're going to be covering the transportation services for dental appointments. So we are partnered with CTS, Coordinated Transportation Solutions, and this is available for all New Hampshire Smile Adult Medicaid members, including those who have any of these conditions. They're able to provide transportation for the member to and from the dental appointment. So we wanted to share how we schedule with CTS for dental appointments. So it is recommended that you schedule 1 to 2 weeks before the scheduled dental appointment. And members must schedule at least 48 hours before the appointment. And if the trip is urgent, which is less than 48 hours or the same day, members must request a ride at least 2 hours in advance of the dental appointment. And these are the modes of transportation covered by CTS, which would be, we're going to be going over family and friends in a different slide. And they also cover wheelchair vehicles for non-emergent, ambulatory, and a lift if needed. For any cancellations, you must contact CTS 2 hours prior to the scheduled trip in order to cancel that transportation service. So the member needs to provide information when scheduling with CTS, and the member would have to provide their name, their home address, their ID number, and the dental provider's office name and address. They would also like the individual provider that the member will be seeing for the dental appointment, if the location is a facility or private office, and the date and time of the appointment. So for family and friends mileage reimbursement through CTS, family members and friends are able to provide transportation for the member to and from the dental appointment. They must contact CTS 48 hours prior to the scheduled dental appointment. And the members must submit a mileage form to CTS, which they can request through their email or through a phone call. And they must complete the form within the 60 days after the appointment in order to get reimbursement. They are available for weekend dental appointments. If the member chooses to do family and friends mileage reimbursement, they would just have to call during business hours and have that form ready for them. And this is our contact information. If members have any questions or need help scheduling a transportation service, they're able to call either our member services or email Turi or myself. And this is the number for the CTS information. All right. And I will hand it over to Judy, who is with New Hampshire Healthy Families.
So my name's Judy Tasker, and I'm with New Hampshire Healthy Families. Thank you very much for the invitation to speak with you all today. New Hampshire Healthy Families partners with MTM to deliver our transportation benefit. And we use MTM for all our non-emergency trips. And emergency trips should, of course, call 911. But all appointments should be scheduled through MTM for any Medicaid covered MCO benefit, but they must be through approved participating providers and some value added services. We cover trips too, such as Alcoholics Anonymous or food banks. If there is a particular type of value added service, it does need to be pre-approved through our care management services. As Michael said, our vendor MTM is going to present later, and we'll go into more of the details of how to book the trips through the app and through the website. But essentially, there are three ways. You can call, or you can go on the website, or you can use the member application. Most of our trips that are not urgent in nature require a 2 business day notice to be scheduled. And the majority of our trips, the best, actually, before we get to that, the friends and family benefit. So if you drive yourself to your trips, or you have a friend or a family member that drives you, your gas, parking, and tolls are eligible to be reimbursed. And you can submit for reimbursement through MTM through a program called Friends and Family. So you need to track your trips. And beginning January 1st, you would need to register the driver, whether that driver is yourself or a friend and family. And then you submit your tracking of the trip, and you submit your driver registration forms, and you get reimbursed through a card called our Focus card. And you can find all the information about that program on the MTM website. For real-time, sorry, my screen keeps jumping ahead. For real-time assistance with issues, the best point of contact is MTM. They can very often assist you live with any problems that you have. The most effective and efficient way to solve a problem is to call MTM first and foremost. So we have their call center and website here, and then you would call New Hampshire Healthy Families if you're not able to resolve something after that. But typically our experience with MTM is very efficient, and they would be the first point of resolution for you. And we'll save sort of the rest of it for MTM. We don't want to steal their thunder while they're doing their presentation later today. So thank you very much.
Hi, everyone. I'm Danielle Murphy, and I'm the transportation coordinator here at WellSense Health Plan. I would just like to say thank you for having us today, myself and my peers. We work very closely together, and we recognize the complexities behind this benefit, and our goal continues to be to make it easier to understand and access, not only for members, but also for providers and agencies or other representatives in trying to navigate transportation. So we hope that this is helpful today. With that being said, our website really has a lot of the nitty-gritty information, and because it is so complex, we want everyone to know where to find this information on our WellSense website. So our main site is wellsense.org, and then you would want to navigate to the Members tab here at the top, and then Medicaid, and then there's Your Benefits, and then the non-emergency transportation. And once you get to that, we have everything sort of laid out and categorized based on the different modes, information about how to schedule, how to submit for reimbursement if you're using the family and friends, and a lot of the other things that Michael and Judy have gone over so far. MTM, Medical Transportation Management, is also our broker, the same as New Hampshire Healthy Families. And our three main ways to schedule rides is to call MTM directly. Members or representatives can also schedule using an online portal, and members can also choose to download and use the member app. On our main website, there's some other sections that focus on transportation, but also some other areas or departments that work with myself to coordinate care for members. So I've included all of these links here. And then we also have Find a Provider. So if a member needs to locate a medical provider that's in network, a care management referral form for members that have complex needs and may benefit from those services within WellSense. And then also the NEMT Quick Summary Guide, which actually summarizes all of the things we're talking about today on one page to help differentiate where phone numbers and other benefit areas may differ. And then here I've listed just some important phone numbers. MTM is the first and foremost. So anything that has to do with scheduling transportation, canceling or changing an upcoming ride, or any escalations, this first number is for MTM. And then these other three are for WellSense specifically, our Member and Provider Services Department, Appeals and Grievances, and then also our Care Management Department. And I will leave it to MTM when they present to share more about scheduling and how to go about those different processes. So thank you. And I'm going to pass it over to Elaine, who's representing CTS today.
Thank you. Okay, good afternoon, everyone. Thank you for having CTS to represent a transportation broker. I just want to let you know that Coordinated Transportation Solutions, or CTS, is the broker that services AmeriHealth, Caritas, DHHS, and DentaQuest. I apologize. I should introduce myself. My name is Elaine Trizzolino. I'm the Senior Account Program Manager at Coordinated Transportation Solutions, or CTS. So CTS's mission strives to efficiently provide transportation services to disadvantaged individuals and communities. Our vision is to add value to our clients and improve the lives of the people we serve. And our values encompass customer focus, integrity, and respect for whom we serve. Okay, going into the modes of transportation offered for our New Hampshire Medicaid MCOs, which also includes Dental, the DentaQuest 21 and over program. So Friends and Family is our mileage reimbursement program, which I've heard a few people touch on so far already, where a member drives themselves to their appointment or someone else drives the member. So reimbursement per mile can vary depending on your health plan. It can range anywhere from 62.5 cents to 70 cents per mile, which also includes reimbursement for tolls and parking. In order to be reimbursed effectively, a trip must be entered into CTS's system prior to your trip date, either by calling CTS or booking your own trips through our app or website. And a reimbursement form must be filled out correctly and in its entirety, along with the parking receipts and toll receipts within 60 days after your date of service, and all returned to CTS. Reimbursements to members can also be in the form of a check sent via USPS or by direct deposit. If someone is driving the member to their appointment, it is the member's responsibility to pay the person who drove them to their appointment. Going through the rest of the modes here, we have public transit. So if a member is within the range of public transit from their residence to a bus stop per se, or a train station, just call CTS and we can make those arrangements and send you your bus pass or your transit pass. There's around a 10-day window turnaround time for you to receive those passes. Then we have ambulatory, which is your taxi livery sedan, and that's a curb-to-curb delivery of the member to their location and pickup. Wheelchair accessible vehicles, which requires a mobility form, and we'll get a little bit more into that at the end there, which can be provided by your healthcare provider or your plan representative. Stretcher van also needs a mobility form, as does ALS and BLS, advanced life support, basic life support. And we also do offer Lyft as a recovery or a last resort only, providing the member has a working cell phone that can accept text messages. CTS has the correct number on file, and providing there are Lyft vehicles available in the area. So again, mobility forms are required for the modes wheelchair and above, but are not required for DentaQuest members, which are the 21 and older dental benefit. Family and friends reimbursement forms must be completed within 60 calendar days, as I stated above, within the last day of service, with all required information in order to receive your reimbursement payment. Okay, here, this is just an overview, like a cheat sheet of who can book trips, what kinds of trips we have here. So anyone who could verify the member's PHI or the health plan representative can call on behalf of the member. So we have demand and subscription trips. So trips can be booked for a single event, which is called demand, or a subscription, which are recurring appointments for up to 3 months for methadone, chemo, and other therapies, which would be 6 months, which also includes dialysis. We have a 15-minute window of time. So the transportation providers can arrive at your pickup residence 15 minutes before or 15 minutes after your scheduled pickup time. Routine medical trips to a Medicaid covered medical provider. We require 2 business days, or we would ideally 2 business days or more than 48 hours notice. Please note that all trips are required to be verified, including urgent trips. Trips that a plan request or a facility request that don't have appointments in our system for urgent care do not need verification. So we run through our same day urgent to a Medicaid covered medical provider, which are 48 hours or same day or 48 hours of or less. Need to be called within 2 hours of your appointment time. And here are some of the examples of urgent trips, which would be urgent care visits, post-surgical, hospital ER discharges, or facility to facility transfer by stretcher or wheelchair. And here are some just other ones: dialysis, chemo. And just to note, any urgent requests that are received after 4 p.m. on a Friday should be called in and not emailed over. The email portion will applies mainly for like hospitals and facilities. Pharmacy trips are permitted. Multiple stops are permitted as well. There may be mileage limitations on some of the locations that you are going to. Cancellations, we require at least a 2 hour in advance of the scheduled pickup time. Non-medical trips, which are out of scope, some of your health plans may offer social or non-medical trips that do have a mileage limitation as well as trip limits. Okay, sorry, moving on here. So here we're just showcasing how this is just a sampling of that CTS now has a web portal and an app so that members can book friends and family trips on their own, as well as view all existing trips they may have in our system. So both the website and the app are very user-friendly and allow members to upload reimbursement forms, as well as driver information, which would be driver's licenses, and what have you. So as a reminder, trips must be in our system prior to your trip date, regardless if they are called in or booked self-serve on the application or the website. So the app, you could scan on the QR code here to download the app in your app stores for iPhone or Androids. And for setting up the account in the web, you could just register and set up your password and then log on and start navigating. And this is just a little more for the app and the portal features. We have all kinds of tutorials here. Again, very user-friendly, very self-explanatory on how to navigate in the app and in the website. And these are all kind of bullet pointed out with screenshots and pictures so that you could see how to go step by step when you are navigating through. Okay. And these are the contact center and the health plan member services phone numbers. As you could see, put the hours of operations up here. So for the routine trip reservations for CTS, you would call this number for any reservations or any other non-emergency medical transportation questions or issues that we can help resolve. And I believe Mike mentioned it at the top of the call. If there are issues or, with your trip in real time, it is best to please call CTS as soon as the issue arises so we can expedite and resolve it in real time. That would be very helpful just to avoid any abrasion or issues of you missing your appointment, those types of issues that we would like to remediate in real time. So calls outside of the above listed times of business will be answered by an IVR in our call system, and members will get a call back from one of our representatives within 1 hour. And I apologize, I did not put a closing slide, but thank you very much. And I will turn it over to the representative of MTM. I will stop sharing my.
All right, we have Stephen Williams with us from MTM today. He's going to be going over how to schedule your transportation, non-emergent medical transportation for both of our clients, which is WellSense and New Hampshire Healthy Families, on our member app. So he's going to really focus in on how simple this is, and hopefully it'll encourage everyone to be looking at this option as a possible way to remove any barriers to transportation you may incur. So Stephen, I'll turn it over to you now.
My name is Stephen Williams. I support New Hampshire Healthy Families as well as WellSense. And I'm going to give you a rundown of the MTM Link member mobile app. This is an app that basically provides members and caregivers with a convenient way to manage rides without calling MTM. They can request new rides, review and cancel schedule rides, track rides in real time. They can submit gas mileage reimbursement claims. They'll have the opportunity to view scheduled rides easily. Once logged in, they can review their scheduled rides. They can find rides for the day. And also they can use something called a daily calendar view where they can find future rides. They can request new rides. The functionality allows members and caregivers to request new rides. Return rides can be scheduled or booked as a will call. You can input special requests such as additional passengers or wheelchair accommodations. And you also have the option to add additional members. You can request additional passengers to ride with you for your appointments. And you also can add special accommodations, such as wheelchair type and the ability to transfer. There's also a wonderful feature called Where's My Ride feature, where it's a real-time GPS map that allows you to see where your ride is and where basically get an ETA, a visual ETA of your actual vehicle coming to you without even bothering to call the call center. You can automatically get this Where's My Ride feature, and you can get an ETA on the transportation provider coming to you without calling a contact center, which is really great. Now the most important thing, or one of the most important things, is claiming GMR trips. If your healthcare plan allows GMR, you can submit your claims from the mobile app. You don't need to use a paper log. You basically can claim on the day of your trip. Okay, so you must claim on the day of your trip in order to use this function, and you can only submit a full claim. And also, just a special note, you can only submit GMR trips that are less than 40 miles one way. Trips more than 40 miles, you'll need to be called in to the CCR line for the GMR trips. So when you begin your trip from your starting address, you're going to click I'm leaving. So you must click this button to begin your trip. When you arrive at your doctor, you click I am here. And you must end your trip using the same mobile device you used to start your trip in order to claim that actual trip. And that's very important. So claiming GMR trips are very easy. The app will make sure your location matches your doctor's address. You will see the message that says location verified. If your location does match, you will see a message that says we could not verify your location. And claiming GMR trips, again, you click the submit reimbursement button after the location has been verified for all legs of your ride, and you'll see a message that your claim was submitted and payment is released in at least 3 days. Please note that you must submit your claim the day of the trip. If not, you have to do a paper log. You cannot submit via the mobile app the day after. And if you did not submit the day of the trip using the mobile app, you'll need to complete a paper trip log. And if you use a paper log, do not cross out or white out anything. And it's also very easy to cancel an existing ride. If you no longer need a ride, you can actually go into the system and cancel it out. And don't forget to verify if you want to cancel your entire trip or just one leg. And the most important thing is that if you need assistance, there is a assistance number that's available to assist you if you have any technical issues. And that's it for my presentation. Sorry about the issues with my tech with my presentation, but thank you so much for your patience.
No worries. So that was a ton of information we heard from lots of people, and I'm just going to address some of the questions that are in the chat box. GMR, what is the meaning of GMR?
Sure, I'll take that. Hey, this is Brian with MTM. GMR, sorry, we use acronyms a lot in non-emergent medical transportation world, and that is gas mileage reimbursement for the state of New Hampshire. That is going to be your friends and family transportation, where you get paid X cents per mile that you drive yourself, or you don't drive yourself, you have someone drive you, so that payee, which will be the member, can be reimbursed for that transportation of having themselves transported by friend or family member.
Thank you. Cindy, you should have the ability to unmute now.
I do. Thank you so much for taking my question. So I'm in a bit of a different situation. I'm a mobility manager. So I am assisting residents throughout the state or throughout my region to find transportation options. And I guess my first question is, what is the best approach when someone calls me that they are so frustrated with their Medicaid transportation that, you know, that their doctor is ready to release them as a patient? I mean, I've heard all kinds of stories. And I also want to preface this with, I love this program, by the way, this Medicaid transportation program. I think it is so useful. And I saw your numbers, 98% transportation matches. It sounds like that you're able to get folks there. But what is, now that I have you all here, what's the best approach that a mobility manager should take when someone calls and says, I am not getting my transportation to my medical appointments? What can I do?
I'll tackle that one to say, first identify your provider or the provider of the person in question. And then we will make sure you have the contact information for the person who is most able to directly handle that. Michael is one for his program, and the others, can you identify yourselves?
Danielle Murphy
Sure.
at WellSense.
Judy Tasker at New Hampshire Healthy Families.
This is Katrina. I just want to jump in and add that there is a non-emergency medical transportation summary guide that's on the DHHS website and likely on the MCO sites as well. I'm not sure. But that lists all of the MCOs and all of the contacts for various needs. I did have the DHHS transportation website as a link in my slides. So Lisa, you can share that when you said you have a one-pager to share, so everyone will have those contacts.
So how am I going to know when my ride is approaching? Am I going to have, like, if they're going to call me, will I have their phone number so I can be sure that I don't ignore their call?
So from the MTM side, what we do so that you're fully aware of who's transporting is the evening prior to transport, the transportation provider is going to reach out to that member to confirm that pickup and make sure that they have the right arrival time that the member is asking for. MTM also sends out an automated voicemail or text option to the member to also confirm that expected arrival time to pick up the member. And that would also have a phone number in it to contact MTM if they have any questions or concerns with that transport.
Thank you. That's right.
Yes, and for CTS, we follow the same protocol as well. When a member is calling in to book the transportation, we ask them if they would like to receive a notification the night before, the day before, or the day of, for either by IVR, phone call, text or phone call or email. So yeah, there are notifications ahead of the trip.
Before we get to Kathy, I'll ask one more for the two of you. What's expected from the rider? Am I going to be asked to pay anything, or should I tip the driver?
Never.
Absolutely not. This is a free service. Do not pay them anything. And if you ever get an ask to be paid, please contact both of the brokers. That's not acceptable.
Can the driver help me get out of my house and into the vehicle if necessary?
Absolutely. During the intake, we get the information from the caller, what's needed for that transport. Just depending on the needs of the member, it can vary. The mode itself could be a stretcher where we would have to go through the door to help the member. That would all be accommodated on that intake part. So we would just determine it based on the member's needs at that point in time, which is done on the intake part with our side. So we communicate that clearly to the transportation provider.
Okay. Kathy, go ahead. I see you got yourself unmuted.
I am unmuted. One problem that we haven't talked about yet is that when I made an appointment for a test that I needed, and the guy on the other end of the phone, I don't have a cell phone because I end up dropping them and then breaking them. So I don't have a cell phone. So when I'm on the phone, like the guy said, could you have somebody else speak for you? Because I can't understand you. And I said, well, and then I said something else, and he did understand me. I said, oh, so you can't understand me. And he said, I understood that. And I just felt like he was rude. And I said, well, I won't have anyone here until later tonight. So no, I don't have anyone else that can speak for me. And he understood that. It's just that, he was just kind of rude. And then I said, can I speak to somebody else that might be able to understand me better? I mean, and the more we talked, the more nervous I got to the worse my voice was. And I just found it totally frustrating.
So Kathy was sharing something that we haven't talked about yet, is that she might call into the provider and they'll say that they can't understand her. And they will ask her if somebody else is there that they can more easily understand. And Kathy says that there should be somebody on their end who can try to better understand her, because that was a bad customer experience for her. Kathy, did that sound about right?
Yeah, did you guys not understand me? I mean, did everybody just about understand me?
Yeah, I
Okay,
can understand.
I think most of us did, Kathy. I think most of us did.
Okay, and I just felt like if the guy tried a little harder, he would have understood me.
All right. Chantal, you have a question?
Yes, I do. I wanted to ask, so I am joining in from a Alpha Home Care. We do the in-home care services, and we get some of our members like frustrated with the caregivers because the caregivers aren't taking them to appointments, and that part isn't included in their services, but they just don't understand that. So where should I direct such members that are having those kind of questions? And then I have a follow-up question as well. For caregivers that are comfortable driving these members to appointments, do these caregivers qualify for the mileage, though I think you guys call it friends and family, or is that not how it works since they are hired with Alpha Home Care?
Who wants to take that one?
I'm sorry, if they're employed with the facility, I believe they still can apply for the reimbursement. I would have to take that back if that's okay.
Yeah, I'm not familiar with exactly the service that's being provided, because the slide I had shared, if it's a waiver service, then transportation would not be part of that, or it could be, but it'd be through the waiver. Whereas if it was a state plan covered service, there might be an option for transportation coverage. So we would just need a little more detail, I think, to be able to definitely understand for that specific scenario.
Thank you.
Yeah.
If there's an aide traveling with a person, they can come on the trip, correct?
Yes.
All right. What if I don't know when my appointment's going to end?
That would be a will call. Which when you're finished, well, when you're about finished, if you know when you're going to be probably about finished or when you are finished with your appointment, you can call to schedule a transportation, but there is a window of time that is given for how long the transportation provider can take to come to your location and pick you up.
Are
Could be about
service
an
animals
hour.
allowed?
I'm sorry?
You can go ahead and finish, Elaine. I'm sorry.
Oh, no, I was going to say, I think it's about an hour to 90 minutes of a window of time. That's not necessarily how long the driver's going to take to get there. It could be within that window of time for the driver to get to you if it's a will call.
Thank you. And I had asked, are service animals allowed?
Yes.
Thank you. B. Smith, I'm going to get you unmuted. What is your question, please?
So I did have a question. I was going to go back to what Chantal was asking from Alpha. She is specific to CFI members. I have some with her. So you need to tell them to call their case manager because issue is that CTS transportation is the transportation service for medical appointments. That is why they're not allowed to have PCSPs drive them back and forth to medical appointments under the waiver. So if they're having trouble figuring it out, then their CFI case manager should be able to help them to schedule the rides. And the PCSP can add accompaniment in the community to the task and ride to and from in the CTS transportation vehicle. They just aren't able to drive them because Medicaid considers it a covered service already.
You'll all notice that I put a QR code up on the screen. That's for the closing survey. Many of you are going to want to get emailed the information that we put together after this session, and you may want to receive an email with the recording of the presentation. So I encourage you to complete that survey so that we know that you have a desire to be on the list of people who get that information. Terry?
Thank you. I have one quick question. I probably already know the answer. Elaine, you mentioned that service animals are able to join the rider.
Yes.
We've heard in a couple of our Transportation Equity Task Force meetings that providers have shown up and have declined to take the rider with a service animal. So at that time, will the rider call the I want to say 1-800 number, but the 888 number that was provided, well, is that the process? If they're okay. And same thing with
they
MTM?
can't. Yeah, they can't. I mean, I know this is an ADA requirement.
Yep.
They can't refuse a service animal. I mean, we do ask, that, if they are going to bring a service animal, just let us know if at all possible. They don't have to, but they can't refuse anybody with a service animal at all.
Okay, we just wanted to verify. So
Yeah.
we'll make sure that in the next meeting that everyone knows, and we'll start providing the resources with the 888 numbers. So we'll keep you guys informed. So thank you.
Thank you.
How long does it take to get reimbursed?
Depending on, for CTS, I know once the family and friends finance team receives the reimbursement form, it usually takes about a week. So if they get it in the beginning of the week, the payment should go out by that Friday. The easiest and quickest is direct deposit. I know, some members are a little leery of giving out their banking information. So if it comes, it'll get mailed out by the Friday.
I'm just going to wrap us up with a couple of slides, and then we'll have some folks hang around if they're available to answer some more questions for us. But I do need to cover some important things. Please mark your calendars for our next Lunch and Learn. That's going to be on November 21st. And we're going to be talking about Keep New Hampshire Moving, which is a website that is a very, very useful tool for helping people to find rides in the state of New Hampshire. It also lists all of our mobility managers and the points of contact if you have specific questions. I would love for you to know that Able New Hampshire is an organization that is supported by membership. And we have one of our employees, Creighton, here with us today, who is supporting me and managing the waiting room and taking care of things behind the scenes. And we wouldn't be able to do that and to provide the kind of support if we didn't have members of Able New Hampshire. So if you're interested in becoming a member, please go to our website, ablenh.com. or you can scan the QR code here. And thank you so much for attending. I'm just going to wrap up the recording and the screen share, and I invite folks who want to ask more questions to stick around. There's a fair chance that some of our representatives will be able to stay with us and answer additional questions.